Welcome to the Cannabis Pharmacology Module, Section 5, Cannabis Pharmacogenomics. Pharmacogenetics refers to the study of genes and the way that certain traits or conditions are passed down from one generation to the other. When it comes to the endocannabinoid system, variability within the endocannabinoid system genes can result in a varied formulation of cannabinoid receptors, enzymes, and ligands. Pharmacogenomics describes the study of all of a person's genes combined and how those genes interact with one another, as well as with the person's environment. Pharmacogenomics utilizes pharmacogenetic information to help determine if a treatment modality will result in a good response, no response, or adverse response in a specific patient population based on their genetic composition and how that medication is expected to interact with the patient's genetic makeup and their environment. There are several genetic mutations found within the endocannabinoid system that have been associated with the development of specific diseases. A mutation in a single nucleotide in the genetic code, which encodes for the formation of the CB1 and CB2 receptors, has been shown to be associated with diseases such as schizophrenia, Parkinson's disease, the development of substance abuse disorders, depression, anxiety, eating disorders, obesity, osteoporosis, and attention deficit disorder. Understanding these pharmacogenetic differences can present new methodologies of medication therapy and a better understanding of the causation of the diseases associated with an endocannabinoid system malfunction within the body. Several pharmacogenomic clinical trials are ongoing in an attempt to understand how pharmacogenomics can impact the response of patients to cannabinoid therapy. Of particular interest is the gene that encodes for catechol O methyltransferase, which is involved in the degradation of dopamine within the body and has been shown to be closely tied to the development of substance use disorder and addiction in patients. Most drug metabolism and action pathways, including the cytochrome P450 genes, are highly influenced by genetic variation. For example, the 2D6 gene in the cytochrome P450 family is highly polymorphic, with over 74 known alleles and allelic frequencies varying greatly between ethnic groups. Depending on the combination of alleles in an individual, drug metabolizing phenotypes associated with the 2D6 enzyme can vary greatly. Allele incidence is classified into functional groups that determine 4 major phenotypes. A poor metabolizer has 2 alleles that are no-function alleles, leading to limited or loss of activity. An intermediate metabolizer has 1 normal allele and 1 reduced allele, or 2 partially reduced alleles, which results in less metabolism of medication. A normal or extensive metabolizer has 2 normal alleles, and an ultra-metabolizer has excess metabolic activity due to duplicate functional alleles. This means that a patient that is a poor metabolizer will have much higher levels of cannabinoids in their body as they are unable to metabolize it properly, whereas an ultra-rapid metabolizer will need much higher doses of cannabis in order to achieve any sort of effect as they metabolize through the cannabis rapidly. A better understanding of these genetic variations within enzymatic pathways will lead to a better understanding of how and when to appropriately dose patients based on their individual genetic composition. Access to accurate testing to predict metabolization of a drug substance for a patient can also be useful in determining whether a patient is exhibiting drug-seeking behavior or has an ultra-metabolism predisposition to need much higher doses of the medication for efficacy. Another example of genetic variation within the cytochrome P450 enzyme family is with the 2C9 polymorphism, which is a single nucleotide polymorphism which results in decreased enzyme activity. The frequency of this polymorphism is about 8% in Caucasian populations. In studies, Patients with the 3,3 genotype have threefold higher THC levels than patients with the 1,1 genotype, meaning patients with this polymorphism need a 2 to 3-fold decrease in oral THC dose. Keep in mind, no adjustment would be needed with inhaled THC dose as it does not undergo first-pass metabolism. Pharmacogenomics may represent an effective strategy for predicting and/or preventing the development of cannabis use disorder, as well as predicting the potential for adverse events and drug interactions among patient populations. Drug metabolism differences among individuals can affect the risk of substance use development. Pharmacogenetics can be used to identify individuals at a greater risk for specific drug dependencies, provide information that can lead to novel treatment and prevention approaches, as well as provide guidance for individualization of treatment choice.